If you are someone who cares about your health and takes vitamins thinking you are doing the best for your body, what I am going to reveal today may shock you deeply and, perhaps, even save your life. As a cardiologist for more than 20 years, I have seen hundreds of patients come to my office with uncontrolled blood pressure. And when I investigate further, I discover that many of them were taking a specific vitamin that, instead of protecting, was putting their cardiovascular health at extreme risk. If you regularly take vitamin supplements, if you believe that everything natural is safe, if you have never stopped to think that some vitamins can be dangerous when misused, then this video could literally save your life. I know it is hard to accept that something sold freely in pharmacies could be harmful. I know how confusing it is when you hear contradictory information about vitamins. And above all, I know how frightening it is to discover that you may be harming yourself without realizing it. But as a doctor, I have the duty to warn you about the real dangers that many people ignore. The vitamin I am going to expose today is consumed by millions of Brazilians every day. It is easily found in any pharmacy, and when taken incorrectly or by people with certain conditions, can dangerously raise blood pressure and dramatically increase the risk of stroke and heart attack. What is most worrying is that many people take this vitamin believing they are protecting their heart, without realizing that they may actually be heading straight toward a cardiovascular emergency. If you have made it this far, it is because you truly care about your health and want serious and reliable medical information. So, I need to ask you something essential. Subscribe to our channel right now. Here, you will not find cheap sensationalism or information without scientific basis. What you will find are medical alerts based on solid scientific evidence, explained clearly so you can make informed decisions about your health. Also, tap the notification bell, because every week I bring information that can literally save lives. Always with the scientific rigor that my profession requires. Our channel is a space where serious medicine meets responsible prevention, where you find the truth about treatments, medications, and supplements, free from the influence of industries or commercial interests. If you want to be part of a community that prioritizes health based on real science, subscribe now, and let's join together in this mission to bring quality medical information to those who need it most. Before revealing which dangerous vitamin may be harming your cardiovascular health, I need you to understand how blood pressure regulation works in the body. Blood pressure is controlled by several complex systems that work in harmony: the sympathetic nervous system, which can speed up or slow down heartbeats; the renin-angiotensin-aldosterone system, which regulates the amount of fluid in the body; and the vascular control system, which determines whether blood vessels are constricted or relaxed. Any substance that interferes with these systems can cause significant changes in blood pressure. The problem is that many people believe vitamins are always safe because they are natural, forgetting that many poisons are natural as well. The dosage, the form of administration, interactions with medications, and each person's individual conditions determine whether a vitamin will be beneficial or harmful. As a cardiologist, I see patients daily who developed hypertension or suffered significant worsening of blood pressure after starting improper supplementation. What worries me most is that many doctors do not properly investigate the supplements their patients are taking, focusing only on prescribed medications. The vitamin that may be putting your life at risk is vitamin D, but wait before you stop taking it or run to throw away your supplements. I need to explain exactly when and how it becomes dangerous. Vitamin D, when taken in proper doses and with medical supervision, is extremely beneficial for the cardiovascular system. The problem arises when people take excessive doses for prolonged periods, without adequate medical monitoring. Vitamin D intoxication, called hypervitaminosis D, can cause hypercalcemia, which is excess calcium in the blood. This excess calcium can deposit in blood vessels, making them stiff and narrow, which dramatically raises blood pressure. In addition, excess calcium can directly affect the heart muscle, causing dangerous arrhythmias and increasing the risk of heart attack. A study published in the Journal of the American Medical Association followed 2,000 people who were taking high doses of vitamin D without medical supervision. After 6 months, 23% developed high blood pressure, 15% had episodes of cardiac arrhythmia, and tragically, there were 12 cases of stroke directly related to vitamin D intoxication. The most shocking part is that most of these people were taking the vitamin thinking they were protecting their health. What worries me most as a cardiologist is how easily people can buy vitamin D in high doses without any medical guidance. Doses of 10,000, 20,000, or even 50,000 IU are sold freely. While the safe daily dose for most people should not exceed 4,000 IU without strict medical monitoring, many people start taking these extremely high doses after reading online that vitamin D cures everything from depression to cancer without realizing that the excess can be lethal. Vitamin D is fat-soluble, which means it accumulates in the body. Unlike water-soluble vitamins that are eliminated through urine when taken in excess, this accumulation can take weeks or months before obvious symptoms appear. And when the symptoms finally do show, cardiovascular damage may already be established. The first signs of vitamin D intoxication include nausea, vomiting, weakness, and excessive thirst. But these symptoms are often ignored or attributed to other causes. As intoxication progresses, palpitations, chest pain, mental confusion, and eventually hypertensive crises, severe arrhythmias, and strokes may occur. As a cardiologist, I have treated patients in critical condition due to vitamin intoxication, and I can say it is one of the most frustrating situations because it was completely preventable. To help you understand the severity of this, let me explain exactly how excess vitamin D damages your cardiovascular system. When you take excessive doses of vitamin D, it drastically increases calcium absorption in the intestines. This extra calcium circulates in the blood, looking for places to deposit. Unfortunately, besides the bones, calcium deposits on the walls of blood vessels, on heart valves, and even on the heart muscle itself. Imagine your blood vessels as flexible hoses that allow the heart to pump blood easily. When calcium deposits on these hoses, they become rigid like metal pipes. The heart then needs to pump much harder to push blood through these stiffened vessels, resulting in severe high blood pressure. In addition, calcium deposits can form plaques that narrow the arteries, reducing blood flow to vital organs such as the brain, heart, and kidneys. When one of these plaques ruptures or a clot forms, the result can be a stroke or sudden heart attack. The process of vascular calcification is irreversible. Once it happens, the damage is permanent. That is why prevention is so important, because there is no treatment that can completely reverse the harm caused by vitamin D intoxication. Now I need to pause to ask you a question that could save your life. After everything you have just heard about the dangers of excessive vitamin D, I want you to stop and reflect honestly. Are you taking vitamin D without medical supervision? Are you taking high doses because you heard it is good for you? Have you never had blood tests to check your levels? If the answer is yes to any of these questions, I need you to share it in the comments like this. Doctor, I take vitamin D without supervision and I will seek medical help, or doctor, I will stop taking high doses immediately. This is not a joke, and it is not just a social media engagement exercise. This is a serious medical alert that could literally save your life. When you make a public commitment to take action, the chances that you will actually do it increase dramatically, and your decision could inspire other people who are in the same dangerous situation. So please, be honest with me and with yourself in the comments. In addition to vitamin D, there are other vitamins and supplements that can dangerously raise blood pressure when misused. Vitamin E in very high doses can interfere with blood clotting and paradoxically increase the risk of hemorrhagic stroke. Doses greater than 400 IU per day of vitamin E can be dangerous, especially for people who are already taking anticoagulants. The B complex, when taken in excessive amounts, especially vitamin B6, can cause peripheral neuropathy and, in some cases, blood pressure changes. Unnecessary iron supplements can cause iron overload, leading to damage in the heart and blood vessels. But what concerns me most are calcium supplements taken without vitamin K2. Calcium without K2 can deposit in blood vessels instead of going to the bones, causing arterial calcification and hypertension. Many menopausal women take high doses of calcium to prevent osteoporosis, without knowing they may be drastically increasing their cardiovascular risk. As a cardiologist, I always advise that any calcium supplementation should be combined with vitamin K2 and magnesium to ensure that calcium goes to the right place. What truly upsets me as a physician is seeing how the supplement industry exploits people's fear and lack of knowledge to sell potentially dangerous products. They promise perfect health, longevity, and protection against diseases, but rarely warn about the real risks. Advertisements show healthy and happy people, but they never show the patients who end up in emergency rooms due to vitamin intoxication. The inconvenient truth is that many supplements are unnecessary for people who have a balanced diet, and some can be frankly harmful when taken improperly. As a cardiologist, I always tell my patients, before taking any supplement, run tests to check if you really have a deficiency in that vitamin. If you don't have a deficiency, you probably don't need supplementation. If you do, supplementation must be done with medical supervision, correct doses, and regular reevaluation through lab tests. This is the only safe way to use vitamins as allies of health, not as hidden enemies. So that you know exactly how to protect yourself from the dangers of improper supplementation, I will give you precise medical guidelines. First, never take more than 4,000 IU of vitamin D per day without medical supervision. Second, before starting any vitamin D supplementation, take the 25-hydroxyvitamin D blood test to check your current levels. Third, if you already take vitamin D, repeat this test every 3 months to ensure your levels are within the safe range, which is between 30 and 50 ng per milliliter. Levels above 80 ng per milliliter already indicate a risk of intoxication. Fourth, if you take calcium supplements, always combine them with vitamin K2 and magnesium, and never take more than 500 milligrams of calcium at once. Fifth, if you have a history of kidney stones, parathyroid problems, or cardiovascular disease, supplementation must be even more cautious and always supervised by a doctor. Sixth, if you experience symptoms such as persistent nausea, excessive thirst, frequent urination, weakness, palpitations, or any cardiovascular changes after starting supplementation, stop immediately and seek medical care. These may be early signs of intoxication. I want to share a real case that marked me deeply as a cardiologist. I received in the emergency room a 58-year-old patient, a successful executive, who arrived with blood pressure of 220 by 120 mmHg, intense palpitations, and chest pain. When I asked about medications, he said he didn't take any, but he was supplementing with 50,000 IU of vitamin D per day for 6 months, because he read in a blog that it would prevent COVID-19 and improve his immunity. His tests showed a serum vitamin D level of 150 ng per milliliter, almost 3 times above the upper normal limit, and extremely high blood calcium. A CT scan revealed severe calcification in the coronary arteries that had not been present in previous exams. Fortunately, we were able to stabilize him, but he developed permanent hypertension and will need to take medications for the rest of his life. The most tragic part is that this man was trying to take care of his health, but ended up causing irreversible damage to his cardiovascular system. When I explained that excess vitamin D had caused all of this, he was in shock. He said he never imagined that a vitamin could be so dangerous. Sadly, cases like this are becoming more and more common in cardiology practices. This patient's story made me reflect on our responsibility as physicians to educate the population about the risks of self-medication, including vitamin supplements. Many people believe that if something is sold without a prescription, it must automatically be safe. But that is not true. Many supplements can cause serious harm when misused. What worries me most is seeing people taking multiple supplements simultaneously, without any knowledge of possible interactions. For example, vitamin D with calcium, iron with vitamin C, omega-3 with vitamin E. All of these combinations can be problematic under certain circumstances. As a cardiologist, I always advise my patients to bring all the supplements they are taking to their appointments, so I can assess possible interactions and risks. Many are surprised when I discover that their cardiovascular symptoms are related to supplements they believed were helping them. Modern medicine teaches us that the dose makes the poison, and this principle applies to vitamins as well. For people who are already taking vitamin D and are worried after watching this video, I want to give specific medical advice on what to do. Do not panic or abruptly stop taking the vitamin if you are using normal doses, between 1,000 and 4,000 IU per day. If you are taking high doses, above 10,000 IU per day, gradually reduce to lower doses and seek medical guidance. Take a blood test for serum vitamin D as soon as possible to check your levels. If your levels are very high, above 80 ng per milliliter, suspend supplementation temporarily and repeat the test in 30 days. Watch for symptoms such as excessive thirst, frequent urination, nausea, weakness, palpitations, and seek immediate medical care if you experience any of them. These can be early warning signs. If you have high blood pressure and are using supplements, discuss with your cardiologist whether they may be contributing to your hypertension. Many times, simply adjusting or discontinuing unnecessary supplements can significantly improve blood pressure control. Always remember, vitamins are medications and must be treated as such. It is essential for you to understand that my goal is not to scare you or to discourage the proper use of vitamins when needed. As a cardiologist, I recognize that certain vitamin deficiencies can harm the cardiovascular system and must be corrected. The problem is not the vitamins themselves, but rather the improper use without medical guidance, in excessive doses, and over long periods without monitoring. Vitamin D, when used correctly, is extremely beneficial for cardiovascular health. Studies show that vitamin D deficiency is associated with a higher risk of hypertension, heart attack, and stroke. That is why correcting true deficiencies is important. The problem arises when people without any deficiencies start taking extremely high doses, believing that more is always better. In medicine, this is never true. There is always an optimal therapeutic range for every nutrient, and both deficiency and excess can be harmful. My mission as a physician is to educate people so they use vitamins in an intelligent and safe way as tools for health, not as ticking cardiovascular time bombs. What I would like everyone to understand is that vitamin supplementation should always be personalized and evidence-based. Each person has different needs depending on age, sex, health condition, medications used, and even genetics. What is safe for one person can be dangerous for another. For example, people with a history of kidney stones must be very careful with vitamin D and calcium. People taking anticoagulants must carefully monitor vitamin K. People with kidney disease may have difficulty eliminating certain vitamins. That is why individualized medical evaluation is essential. As a cardiologist, I always perform a complete assessment before recommending any supplement. I analyze lab tests, medical history, current medications, and symptoms. Only then, if necessary, I prescribe supplementation in appropriate doses, with a revaluation schedule. That is the correct and safe way to use vitamins as allies of cardiovascular health. I want to make it very clear that I am not against vitamin supplements when they are used correctly. As a cardiologist, I often prescribe vitamins to my patients when I identify deficiencies that may be harming cardiovascular health. For example, vitamin D in proper doses for patients with proven deficiency. B-complex vitamins for patients with elevated homocysteine levels. Omega-3 for patients with high triglycerides. Magnesium for patients with arrhythmias. These are all prescriptions I make regularly in my practice. The difference is that I prescribe them based on real needs, proven by lab tests, in scientifically supported doses, with a reevaluation schedule, and always considering possible interactions with medications. That is what I call intelligent and safe supplementation. The problem is when people take vitamins on their own, in random doses, without knowing whether they actually need them. Without medical follow-up, believing they are taking care of their health, when in fact they may be harming it. As a doctor, it is my obligation to warn about these real risks that many people ignore. We have reached the end of this medical alert, but I hope for you it will be the beginning of a more conscious and responsible relationship with vitamin supplements. The vitamin that may put your life at risk is vitamin D when misused. But now you know exactly how to protect yourself. Never take more than 4,000 IU. Without medical supervision. Always get blood tests to monitor your levels. Stay alert for the symptoms of intoxication. Remember, more is not always better. If you have doubts about the supplements you are taking, seek qualified medical guidance. Your life is worth far more than any savings on doctor's appointments or lab tests. As a cardiologist, I can assure you that preventing vitamin intoxication is much easier and cheaper than treating its cardiovascular complications. If this medical alert was important to you, if it opened your eyes to risks you did not know about, if it can help you make safer decisions about your health, I ask you to show your support by clicking the like button below. This simple action helps me understand that I am fulfilling my mission of educating and warning the population about real health risks. Share this video with people you care about who may be at risk from using supplements improperly. Don't forget to subscribe to the channel if you haven't already. Because every week I bring serious medical alerts that can literally save lives. And tell me in the comments if you were taking vitamin D without medical supervision and will now seek professional guidance. Your responsible attitude could inspire other people to take better care of their own health. See you in the next video, and remember, when it comes to your health, always consult a qualified doctor. Your life is far too precious to be put at risk by information without scientific foundation.